Psoriasis is again an autoimmune disorder where the shiny skin plaques appears over the skin associated with tremendous itching and burning sensation. Because of the continuous itching sensation, they may go into the secondary infection. When there is a secondary infection, patient has to go for a systemic treatment. You know, it has become a social burden now. In terms of a social, again, as we talk with regard to the vitiligo, is a social stigma, and psoriasis is also considered to be a social stigma when it is appeared on the exposed areas. The psoriasis patient will have restless nights because of the continuous itching and prolonged illness. They have to frequently go to the doctor for consultation. Psoriatic patient has a lot of responsibilities, not only in terms of to look after his family, to look after himself because of the morbidity attached to it. Since the pain and the condition, the itching is the worst, makes the patient condition worse. The aggravating factors are the stress, tobacco consumption, alcohol consumption, and deprived of the sunlight. Because most of the patients, especially feminine gender, either they go to the domestic conditions, remain in the, or the working condition where they deprived of the exposure to the sunlight. It has a different types, and every type is considered to be very important in terms of seeking the treatment. When the lesions are on exposed areas, when lesions are not on exposed areas, probably both the conditions may lead to the itching, and itching will lead to the morbidity, increase in the morbidity with regard to the psoriasis. When we talk about the psoriasis, there are many types: gutty psoriasis, psoriasis of the nails, psoriasis of the major part of the bodies, psoriasis of the part of the bodies, localized areas, extensive areas. It has this effect of the climatic effect also. Generally, winter it get aggravated, and summer it is self-limiting. And being an autoimmune disorder, again we need to have an autoimmunity where the rapid increase in the cells, abnormal increase of the cells, which leads to the plaques of the psoriasis. Very peculiar sign is that it is always preceded with itching. When there is a itching, it is looks like a shiny scar followed by the scaling. Scaling is considered a very characteristic feature in the psoriasis. And as far as the psoriasis treatment is concerned, there is no full treatment which controls the entire remission of the psoriatic lesions is available across the systems, across the globe rather. Unani system of medicine has a greater role in control the autoimmune phase of vitiligo, control the itching, burning, which is related with the considered to be cardinal signs of psoriasis, and regression of the psoriasis plaque itself. When you are able to control the itching, probably patient will not have discomfort related with the psoriasis, then it allows the normal healing of the patch. When we have a topical application and the systemic drugs which controls the itching and burning sensation, number one, to resolving the lesions, then secondary is when the patient start resolving, then it gives a very good impact on the psychology of the patient, then probably that helps in the healing process. And this treatment is considered only 3 to 4 months of treatment, which has as good as 80 to 90% of the recovery in terms of resolving the psoriatic lesions. When psoriatic lesions are resolved, then itching will reduce, the burning sensation will reduce. When itching and burning sensation reduce, these are some, because this is always signs, striking signs with psoriasis. Then when it is reduced, patients overall quality of life improves. When the quality of life improves, he can be back to the work, he can take care of not his own himself, but his own service need and personal need, and the society and the family needs. So psoriasis again is considered to be a metabolic disorder. Since it is a metabolic disorder, since it is an autoimmune disorder, it has periodic episodes of aggravation. When periodic aggravation takes place, then again and again we need to have a treatment. So the point is, it's just not to have a drug to which temporarily regulates the lesions. The point of treatment in psoriasis is not just to regress the lesions or to control the itching, because if you temporarily control the itching, probably initially it regresses, then again it can bounce back the entire condition. Then in that case, what we need to do is, we need to have a systemic drug. Unani system of medicine offers the excellent systemic drug, both as a cocktail drugs, the blood purifying agents, overcome the resistance, correct the metabolic errors in psoriatic lesions. So these treatment is, once the patient is rooted thorough, then probably this will ensure the long term regression of the psoriasis. At the same time, we have an excellent drug in terms of the external application. When we do a topical application, probably that controls the itching. When you control the itching, patient may not go into the long term complications like secondary infections. When there is no secondary infection, that will help in regaining the lesions or resolving the lesions at the early stage. So United System of Medicine has some drugs which is called as a Munzig and Musil drug, Cocktail and purgative drugs, which has a systemic correction. Systemic metabolic derangements will be corrected. When the systemic metabolic derangements are corrected with regard to the psoriatic lesions, it will have a long time impact which suppresses the regrowth of these lesions, and overall quality of life of the patient is generally much improved. When you treat the pills, but the patient has to follow the certain conditions, instructions with regard to avoid the stress, certain diet restrictions, not too much of non-vegetarian thing, with regard to the avoid alcohol, and these are the things will ensure the long-term quality of the life of the patient. Unani medicine has definite role in not only have an offer the best remedy, but to the extent of possible 100% remedy in terms of treating the psoriasis.